And I now want to welcome my other colleague, Arzoo, who will tell us a little bit more about how the advocacy actually works and what are the levels hidden there and what are essential things for us to know.
Thank you, Aistė, and all of the organisers at Galen and UCARE for you for, as Kristen, you just said very nicely, elevating the patient voice today. So Kristen mentioned an area of advocacy, which is self-advocacy, which involves stepping outside of that traditional doctor-patient relationship to equip patients to advocate for themselves. And I'm going to share a bit about my journey today with urticaria and how it is that I practiced that self-advocacy, the challenges that I faced navigating the healthcare system, and how it was that patient information and advocacy organizations really helped me in that process. And I'll end with a few tips and survival tips and lessons that I've learned along the way for both patients and those working in the professional sector. So a little bit about myself before I start. Although I'm here as a patient today talking about my journey with urticaria, I actually work in the healthcare research space myself, so not as a scientist, but in the ethics and policy side. I'm head of ethics for the UK's largest healthcare research programme, Our Future Health. And in that organisation, we're aiming to recruit 5 million UK adults. So that's almost 1 in 10 of the UK adult population to join this healthcare research programme. And I will just go on to the next slide. It was in July 2022, and hopefully nobody on this call is squirmish because we're all either familiar with urticaria ourselves or we've been exposed to it in our profession. But I thought I would bring this to life by sharing a couple of pictures of what my skin looked like over the 10.5 months of my daily outbreaks of urticaria. So it was in July last year, 2022, that I got my 3rd COVID infection. I was fully vaccinated, and a week into my 3rd COVID infection, I just broke out in full body urticaria. Nothing like this had ever happened to me before, so this was, I just thought, what's happening to me? Am I about to die? You know, something, because I had no idea what urticaria was, but waking up just covered in hives head to toe was absolutely terrifying. And from July, I guess, for about 10 months, this was my skin almost every day. We managed it with, you can see this cocktail of drugs that I've put on the slide as well. A whole host of antihistamines, stomach ulcer medications, Montelukast, all sorts of, I think every 2 to 3 weeks, the GP was changing my medication. So we were trying everything that we could to manage this condition. There was a lot of inflammation, swelling, itching. I had never experienced fatigue like this in my life before. I obviously turned to the internet. That was my first go-to. How can I find out if anyone else has experienced the same thing and how it is that they've navigated this? What should I do about my food? I pretty much changed everything. I got to a stage where I discovered that I have autoimmune urticaria, but foods, although they don't cause this type of urticaria, they do exacerbate it. So, you know, if you've already got loads of histamine in your body and you're taking foods that are high in histamine, you're just adding to what's already there. So I pretty much changed my entire diet around. It didn't make it go away, but it did help with managing the severity of the outbreaks every day. I think one of the biggest changes for me was this fear of things that I could do every day, like go out, meet my friends, travel. I'm a very active, sociable person, kind of almost traveling between cities every other day. And for a few months, I didn't want to leave my home because I was terrified of how I appeared. I didn't recognize myself. My daily routine was just waking up and pretty much just examining my skin, taking pictures, wondering like how much longer this was going to go on. And in terms of how I navigated my condition within the UK healthcare system, I was pretty much, I had an appointment with my GP almost every week to every 2 weeks. We were touching base and figuring out what could be the next step in the management of my condition. But what I discovered very quickly was that my condition was being dismissed just as a skin condition. Oh, it's just hives. Someone in the comments, actually, I was reading the Q&A earlier. Someone in the comments has put a really important question, which is, how do we enable healthcare practitioners to move beyond this narrative of it's just hives and it will just go away? And that was what I was faced with. You know, there's no idea why this is happening. You just have to live with it. Here's a little leaflet. Go away, read it. I think the leaflet was 10 years out of date. I started reading medical research papers. So, Kristin, the point that you just made around producing lay summaries of research papers really struck a chord, because actually I was reading these papers and there's a point up until which I could follow what was going on, after which I thought, I need a specialist to translate this for me. And I remember 2 months into this daily outbreaks, I said to my GP, and I was probably in tears at this point, I said, look, I can't live with this any longer. I need to speak to a specialist. And my GP's first response was, well, what do you think a specialist is going to tell you? We're doing everything. We've given you the full treatment plan. We've gone through all, you know, there's different stages of drugs, and we've gone through all of them, and you're on all of them now. So what do you think a specialist is going to tell you? And I said, well, I've been reading all of these papers and there are things in there I don't understand. If I knew what a specialist was going to say, I wouldn't need to talk to them. So, you know, the doctor was like, oh, that's a good enough explanation. So, you know, you've got to imagine the mindset of a patient when they are sleep deprived, covered in hives, itchy, irritated, can't eat normal food, can't see their friends. Their entire life has been turned upside down. And you're asking them to explain to you why they need to see a specialist. And I think it really goes back to that point about, I know that challenging that patient-doctor relationship is important, but are we placing an unfair burden sometimes on patients to really like be their advocates when they're in a very difficult situation? And I think it takes a lot of resilience. It takes a lot of willpower and support and clarity to keep pushing against that system that is, in a sense, pushing back against you and telling you your condition is not really that severe. It will be okay. And some of the practical challenges that I faced were like having to speak to a different doctor every week. So it wasn't that I had the same doctor that I could keep in touch with, but my point of contact in the GP surgery kept changing. I would have to go and pick up my medication almost every 2 weeks because they wouldn't prescribe me like 2 to 3 months at a time. So each time I went to the pharmacy, there was some mix-up. One of my drugs was missing, the quantity was wrong. And, you know, the number of times I came back from the pharmacy, I think just crying because I couldn't go through that process again and again of calling my GP, calling the GP pharmacist, going back to the pharmacy. It really took everything out of me. When we finally agreed that we could contact a specialist, the letter I got back from the NHS was a date 10 months down the line. So I was experiencing this condition in July, August 2022, but I was sent an appointment for April 2023. And it just disbelief when I opened that letter. I couldn't actually comprehend that I would have to wait another 7 months to see a specialist, that this was now going to be my life. And I think it's that uncertainty of not knowing how long a condition like this is going to remain. There's a real lack of knowledge and awareness around, you know, in a sense, how rare urticaria in this sense is when it goes beyond the 6-week mark and how it then impacts patients. And that I really struggled with my healthcare practitioners. But there was some hope. In December 2022, I used to almost daily type into Google urticaria COVID research treatments almost every day because I just wanted an answer. I wanted to know where I could go for some guidance and a better sense of how I could manage my condition. I'd actually diagnosed my condition before my doctor through all the reading that I had done. So it took them 2 months to tell me I have chronic spontaneous urticaria. I think 3 weeks in, I was like, yeah, I think I've got CSU just by reading everything on the internet. And it was in December that I came across a tweet, I think it was perhaps by Marcus or somebody else, that there is a global urticaria forum taking place in Berlin. This was a Sunday evening. The conference was starting on a Tuesday. I was not even in the same country, but I emailed the organizers and I said, I've seen that you've got this conference taking place. Please, could I attend? I'm not sure if you have any patients or patient organizations attending, but I would really appreciate it if you could allow me to attend. And I got this, within less than 24 hours, I got this incredible reply back saying, of course you're welcome and you don't need to pay the registration fee. Come along and, take from it what you need. And like off I went to Berlin. I think I just contacted my boss at work and said, I need to go. I need to learn more about my condition. I need to go and meet the experts. And I had actually already been stalking a lot of the experts online because I was thinking, I can't wait 6 to 7 more months before I see a specialist. I need to talk to people sooner. So I was almost thinking, can I afford to go private? And I started looking up, which consultants had written and published about urticaria. So when I got to this conference, I started seeing these people that I had been reading about for the last 6 weeks. And I obviously went to them not as, hello, I'm a patient of urticaria, but, oh, I work in healthcare research. What would you say to a patient with XYZ management plan? And, it was incredible being in a room after having several months of no real guidance, no knowledge, being in a room where people are showing you diagrams of what's happening under your skin and your body. The fact that this is a systemic condition is not just a skin condition. There's different parts of your body that are involved. This is affecting you and your life in so many ways we don't even know yet. That there are effective treatments out there that can help you live with urticaria, that there are clinical trials, that, that there are potentially some answers even if we don't have all of the answers. And it was incredibly empowering for me to be in this space, quite daunting at times because we know that we don't have all the answers. And I think being able to accept that reality of, well, there are some unknowns and very big unknowns, even amongst the specialists, can feel like quite, it can feel like a downer. But at the same time, I think it gave me hope in research in a way that even whilst working in a healthcare research organization, I hadn't really connected with how it is that patients almost come to rely on researchers to bring those answers and to help guide us for what the future could hold for us. So I'm very grateful to Galen and UCARE for you again for opening up that space for me and allowing me to connect directly with the specialists. 10 months later, in April 2023, my long-awaited NHS appointment arrived, and off I went to the hospital. It was actually on Eid day, so it was the end of the month of Ramadan. On Eid day was my appointment, so I was like, the NHS has given me a gift on Eid, my monoclonal antibodies in the form of omalizumab. And, since I got my first dose, initially you have an outbreak. I think the first 2 to 3 days it can exacerbate your urticaria, but since that day I have not had a single outbreak of hives, and that's now been 6 months. And it's just unbelievable for me to think that I could have had this 7 to 8 months ago. But the very long waiting time, I think, reflects the poor access, the poor prioritization for people who are affected by chronic urticaria. It's a real lack of awareness of how this condition affects people like us, what we have to live through to get to that point of finally being given the treatment that we need. And we know that this medication won't give us all of the answers. I'm in my 2-month waiting period now, so they take you off omalizumab after 6 months as per protocol to see if your hives come back or whether your condition is managed. And I met a patient at my last appointment who has been on the drug for 3 years now. So I asked him, what happens when you come off it? And he just said, well, the hives all come creeping back as soon as you come off the drug. So there are some difficult realities to accept with even the medication plans, but at least you have that hope. My final slide is, I know we're almost running out of time, so I'm going to be really quick now. But what are some of the things that I learned in this process and some survival tips? I think being proactive, persisting for better outcome, for better treatments and management plans, not underestimating the impact and severity of your condition. You as a patient are the expert on your condition, value your perspective, and really expand your search for knowledge and who you go to talk to. The systemic nature of urticaria is often underestimated and not acknowledged, but there is hope in the community of researchers who are building this picture for us and still searching for answers. So thank you so much. I'm sorry to go over my time.
Thank you very much for sharing your story. And just a quick question. After going through all of this journey, all of these obstacles yourself and being actively involved in the advocacy, how does the perspective of the healthcare system in general looks like from your point of view after you've been through all of that?
Quite poor, I think. So it's really helpful for me in my job to be able to see this other side of the healthcare system and where all the blockers are and how we need to really rethink how we define what severity is and how and when we allocate resource to people with different conditions. And I think conditions like urticaria are at the bottom of the list, and there's a lot more we need to do to shift that policy landscape.
Oh, that's for sure. But I will now then try to somehow summarize everything together. And I think that my presentation will be like the cherry